If you're a medical student, you're trying to figure out what specialty you want to do, I would ask you, what do you have the most room in your heart for? What does that patient look like? What conversations are you going to have? What pathology is that, right? Some people will say, what is the most exciting part of that specialty? What excites you the most? But then other people will say 95% of that is probably not going to be the most exciting thing. There are shifts where I don't intubate or do chest tubes or do central lines or whatever. A lot of the bread and butter emergency medicine is chest pain, abdominal pain, shortness of breath, things like that. I have a lot of room in my heart for that. Right now I'm doing peds shifts. If I do peds 3-4 times a month, I think that's a cool balance for me. But I don't know how much room in my heart I have for the suffering of children. I have a lot of respect for people who do peds because you get the highest of highs, the lowest of lows, and parents can be annoying, whatever. But I don't know, as a parent of 2 daughters, how many times I can have certain sad conversations. You can use your imagination. One thing I have a lot of room in my heart for are people with substance use issues, people who come in with intoxication or withdrawal, or they have a dependence besides their ACS, chest pain, rule out, whatever. I could have those conversations every day, and a patient could say, I'm not going to listen to what you say, every day for those conversations. I have a lot of room in my heart for that. But it's not an infinite amount of space. I didn't become a psychiatrist for a reason. Post-operative complications, I had no interest in operating room conversations. I have a lot of respect for folks with primary care, but I don't have a lot of space in my brain or heart for hypertension or diabetes management, or managing a lot of chronic issues with subspecialists on an outpatient setting. So overall, I think it's not entirely fair to ask a third-year medical student or a fourth-year medical student who hasn't decided yet, what's the most exciting thing? What do you think you could tolerate the most? They don't have that experience, but they have a heart with space in it. So I asked them what they think about that.